Anxiety disorders introduction. Anxiety disorders are a group of mental health conditions characterized by excessive and persistent worry, fear, or apprehension that can significantly impact daily life. This video aims to provide an educational overview of anxiety disorders, including a differentiation between fear, normative anxiety, and pathological anxiety. It will also delve into the physical findings associated with anxiety, the role of neurotransmitters, and specific diagnostic criteria for various anxiety-related disorders. 1. Differentiation of fear, normative anxiety, and pathological anxiety. Fear versus normative anxiety versus pathological anxiety. Fear is a natural response to a real or perceived threat, triggering the body's fight or flight response. Normative anxiety is a regular emotional response to stressors, motivating adaptive behaviors. Pathological anxiety, however, involves excessive and irrational worry, often interfering with daily functioning. Physical findings common to anxiety. Common physical findings in individuals with anxiety include increased heart rate, muscle tension, restlessness, sweating, trembling, and gastrointestinal discomfort. Chronic anxiety may contribute to long-term health issues, such as cardiovascular problems. See neurotransmitters associated with anxiety. Neurotransmitters play a crucial role in anxiety regulation. Gamma-aminobutyric acid, GABA, has an inhibitory effect, reducing neural excitability. Imbalances in serotonin and norepinephrine are associated with mood and anxiety disorders. The intricate interplay of these neurotransmitters influences emotional states and contributes to anxiety symptoms. 2. Anxiety disorders. Diagnostic criteria for generalized anxiety disorder, GAD. GAD is diagnosed when excessive worry and anxiety persist for at least 6 months, accompanied by symptoms such as restlessness, fatigue, irritability, muscle tension, and sleep disturbances. Panic attacks versus panic disorder. Panic attacks are abrupt surges of intense fear, often accompanied by physical symptoms. Panic disorder is diagnosed when recurrent panic attacks are followed by persistent worry about future attacks and a change in behavior to avoid situations that may trigger panic. See behavior associated with specific phobias. Specific phobias involve an intense fear of a specific object or situation, leading to avoidance behaviors. These fears are excessive and disproportionate to the actual threat posed by the phobic stimulus. Agoraphobia versus social anxiety disorder. Agoraphobia involves fear of situations where escape might be difficult or embarrassing, often leading to avoidance. Social anxiety disorder is characterized by intense fear of social situations, leading to avoidance of interactions due to fear of embarrassment or judgment. 3. Obsessive-compulsive and related disorders. Distinguishing obsessions from compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges causing significant distress. Compulsions are repetitive behaviors or mental acts performed to alleviate anxiety or prevent a feared event. Diagnostic criteria for obsessive-compulsive disorder, OCD. OCD is diagnosed when obsessions and compulsions significantly interfere with daily life, lasting for at least 1 hour per day. See behaviors associated with trichotillomania. Trichotillomania involves recurrent hair pulling, leading to noticeable hair loss and distress. It is classified as a body-focused repetitive behavior disorder. 4. Trauma and stressor-related disorders. Diagnostic criteria for post-traumatic stress disorder, PTSD. PTSD results from exposure to traumatic events, leading to intrusive thoughts, avoidance, negative alterations in mood and cognition, and increased arousal and reactivity. Distinguishing onset, types, and durations of stressors. Adjustment disorder involves a maladaptive response to stressors within 3 months, lasting no longer than 6 months. Acute stress disorder involves symptoms lasting from 3 days to 4 weeks post-trauma. PTSD symptoms persist for more than 1 month. 5. Somatic symptom and related disorders. Distinguishing somatic symptom disorder from illness anxiety disorder. Somatic symptom disorder involves excessive focus on physical symptoms, leading to significant distress. Illness anxiety disorder involves excessive worry about having a serious medical condition without evident physical symptoms. Differentiating conversion disorder, factitious disorder, and malingering. Conversion disorder involves neurological symptoms incompatible with known medical conditions. Factitious disorder involves intentionally feigning or exaggerating symptoms without obvious external rewards. Malingering involves fabricating or exaggerating symptoms for external gain. Conclusion: understanding anxiety disorders and related conditions is crucial for accurate diagnosis and effective treatment. By exploring the differentiation between fear, normative anxiety, and pathological anxiety, as well as delving into specific diagnostic criteria and behaviors associated with different disorders, healthcare professionals can provide comprehensive care for individuals grappling with these conditions.